Hi, my name is Rachel Beilke, and today I will be interviewing my mom, Caroline Beilke, about her experiences with nurses. And yeah, so Mom, if you could summarize your image, that one word be and why?
After giving this some thought, I would have to say overall I would pick the word support. And what I mean by this is support not just by doing what is medically necessary for a patient, but also the mental health and well-being of the patient, the support you give to the family, figuring out other supports that the family and patient are going to need. They are the nurses are the ones that pick up the pieces after a doctor has come in and given possibly a life-changing, life-threatening um, diagnosis, and the nurses are left to support the patient and to help the family to move on, and also to help the family to know that they can, there is hope and help out there for them.
So, based on that, tell us how an interaction with a nurse has made a difference in your life.
Okay. My son Cliff was diagnosed with ALL in 2008 when he was 8 years old. We were supported by the nurses from the day one. The emergency room nurse was right there to help us and help us stay calm and to be there for Cliff when me and Cliff's dad were both terribly upset and trying to figure out what to do, from the emergency room up to the PICU, and be in that kind of situation with not just Cliff and what we were dealing with him, but all the other kids who were hooked up to so many things, and many of them just asleep and kept sedated in the PICU, and that was quite something to see. And the nurses were there to make sure that we were not overwhelmed by all that, so that we could be there for Cliff. They were right there, right by Cliff's side, all while we were in the PICU, and then when we were moved down to the regular hospital, and then also for the 3.5 years, well now even past then, that we go to the clinic. We have our own nurse at MUSC. We have a nurse, they pair you with a nurse, so we have a good relationship with me. And we also have a nurse practitioner, that Nurse Diane, who we usually see regularly. So they both have always been there for us. I knew that they were just a phone call away for all these years, and now it's been, in September, it will be 5 years that we've been going through this.
So, based on all your experiences with Cliff and the nurses and how well of a job they did to help, do you have any recommendations for future nurses or students in nursing school?
Yes, you are there not just to do your job from the medical standpoint, which of course is very important to learn all that and to be right on top of that, but from a patient and a patient's mom and family's perspective, our nurses have, with, like I say, helping to support us so that we can do what is right for Cliff. And that's one example. Also, I want to say that just as a nurse for the future, you could think about going into pediatrics and going into oncology. And I know that those are difficult, but there's a lot of need, and you really get to know your families and be there for them. And for if you are the type of nurse who wants to have more of a long-term relationship with patients, these areas would be, particularly oncology, pediatric oncology would be a great area to go into.
Well, awesome. Thank you so much for giving me your time. I was doing well, especially since he's my little brother. And hope you have a good day.
Thank you, and good luck.